Welcome, everyone. If you're a massage therapist looking to become more confident with prenatal massage, you're in the right place. One of the biggest misconceptions I hear is that prenatal massage has to be extremely light. In reality, safe prenatal massage isn't defined by how light the pressure is, it's defined by your clinical reasoning, positioning, communication, and technique. Upper body prenatal massage techniques using both prone and sideline positioning. One of the things I love doing in any massage is actually pushing all the tension away from the spine. One thing to remember is every pregnancy is different. Every client is different. If this is a brand new client, I'm going to be more conservative with my approach. Even if they tell me they love deep pressure, I don't immediately start with deep work. Instead, I gradually increase pressure throughout the session while constantly checking their comfort. As trust builds over multiple appointments, many clients tolerate, even prefer more therapeutic pressure. In the beginning, incorporating push and pull techniques and kneading techniques to warm up the traps and surrounding muscles, helping improve circulation, reduce protective muscle guarding, preparing the tissue for more focused work later. Notice that most movements I do will stay broad. Broad contact distributes pressure over a large surface area, making therapeutic work much more comfortable than using a sharp point. Broad pressure does not equal deep pressure. Broad forearm contact can feel significantly more comfortable than a thumb using much less surface area. As treatment progresses, I may begin incorporating my forearm and in some areas even my elbow. Yes, even during prenatal massage. The important part is how you use the tools. I never drive an elbow into tissue. Instead, I use broad controlled contact while carefully monitoring tissue response and continuously communicating with the client. Good prenatal massage is never about forcing tissue to change. It's about working with the body instead of against it. If a client begins guarding, holding their teeth, or becoming uncomfortable, then that's definitely a signal to back off. Pain doesn't equal better results. The nervous system always has the final say. Throughout the treatment, I constantly ask myself, how is the tissue responding? Is the client relaxed? Can I safely increase pressure? Or would a broader, slower technique provide a better outcome? These questions help guide every decision I make. You'll also notice I occasionally include gentle stretching and movement. I'm never forcing range of motion. These small changes help encourage relaxation, improve mobility, and often make the massage techniques themselves more effective. Everything is slow, everything is controlled, everything stays within the client's comfortable level. One reminder for massage therapists is that prenatal massage clients are not all the same. Remember, some clients can comfortably tolerate moderate or firm pressure. Others prefer much lighter work. Your job isn't to use the same pressure on everyone. Your job is to adapt your treatment to the person on your table. Clinical reasoning will always outperform memorizing a routine. As the session continues, I am constantly reassessing. Instead of chasing individual knots, I'm looking at how the entire upper body is functioning together. How are the shoulders moving? Is the muscles beginning to soften? Has breathing become more relaxed? Those observations tell me much more than simply finding out which areas are tender. If you're trying to improve your prenatal massage skills, focus less on memorizing techniques and more on understanding each client and the technique that is being used. When you understand the purpose behind your treatment, you naturally become a more confident massage therapist. This part here is a really good example. You see how I'm guiding my forearm along under the shoulder blade? You go very slow and let the client breathe through it, hitting the tender points, holding, and letting it release. Hitting trigger points are okay, you have to soothe the area and spread out the blood flow after. Just don't overwork an area. Remember, the body releases relaxing the ligaments and joints, meaning a prenatal client does not recover as fast. And there's no going back if you went too deep, so work within the client's comfortability and spread it out during sessions. While doing sideline techniques, I'd like to guide my fingers between the spine and shoulder, going all the way up with slow, firm pressure, breaking up all that tension and relaxing the muscles. Plus, this technique just feels good. And when you find those tight spots, just cross-fiber it a little bit and it should break up. When the client's on their side, it's actually a really effective way to get into these upper traps and surrounding muscles. Using your fists, just do a slow stretch and push. This should feel really great because a lot of pregnant clients get a lot of tension in their neck and shoulders from all the gravity going forward on their body. And of course, always knead the shoulders. It feels so good and relaxing. If you have any questions, you can always comment below and I'll get back to you as soon as possible. And I also have a full prenatal playlist. Massage therapists, let me know what prenatal massage techniques you like to see or that you like to do in your treatment. Or if you're a client, have you had a prenatal massage? Let me know how it went. This next neck technique is really good at breaking up the tension around the neck. Hook your fingers around each side of the spine and press and release, and you can kind of guide your hand thumbs down the neck. A bonus if you actually hold the pressure and pull their head backwards, and that helps with forward head posture that happens a lot on people. Pregnant clients tend to get really tight on their head and neck, so they get headaches as well. This work should really help with that. And next, I like to open up the shoulders by working along the rib cage and under the shoulder blade. Have the arm above the body so it can open up the whole lats and surrounding muscle tissue. This is a great way to open the shoulders. I also recommend, if you are working on a prenatal client, if they're okay with it, to work on the pecs, because all of that rotation going forward can cause so much problems in the back. If you're interested in the prenatal massage pillow that I use in the beginning of the video, I'll put the link in the description, along with some other links that you can check out and see all my other channels too. If you're interested in some massage therapy continuing education courses, I have some online ones I'll add in the description. Along with, if you're in the Humble, Texas area or Houston area, I do massage continuing education live. Just send me a message at restorationmassagecenter@gmail.com. Hope you enjoyed this video. Please save, share with your friends, and subscribe. And don't forget to check out my prenatal playlist where I have other massage techniques as well. Thank you so much for watching and have a great day.